I am the Director of Health and Safety for the United Food and Commercial Workers International Union. We represent workers in meatpacking and poultry, about 250,000 workers in these industries, as well as about 900,000 workers in grocery store, other retail, and warehouse distribution. So thank you very much for the invitation to speak at the conference. I'm going to try to start off with try to put a personal face on this this subject, on behalf of all the workers who have given up their health and their lives to feed America. I'll talk a little bit about working conditions in a meatpacking and poultry plant, conditions that have led to the spread of COVID and resulted in outbreaks, and what we've learned so far about COVID. So I will start just with a few numbers. The UFCW does collect data on infections among UFCW represented workforce, but we and our sister unions only represent a fraction of the industry. So what you see in front of you is data collected by a organization called the Food and Environmental Reporting Network. It's a nonprofit news organization that has been tracking outbreaks in the food system since the beginning of the pandemic. And you can see as of February 12th, their information here. And their website is thefern.org. You can actually go on, and they just do a great job of tracking 8 outbreaks around the country in these different industries. So I'd like to put a face on some of the workers, UFCW members, who have lost their lives to COVID as a result of working in a meatpacking or poultry plant. I tried to edit this slide and add the 4th individual on the right. His name is David Avila Loma. He worked at a JBS plant in Greeley, Colorado, died April 2020 of COVID-19 and pneumonia. So I'd like to start this presentation reading from a letter written by Carmen Dominguez, a union steward at the JBS plant where Enoch Benjamin worked. She wrote this about conditions in March and April at this JBS plant, which is in Sauderton, Pennsylvania, and about conditions there. And this was soon after Mr. Benjamin died. And she writes, on a normal day, working at a meatpacking plant is not easy. The slaughterhouse is boiling hot. People who aren't used to the temperature can feel as if they're experiencing high blood pressure. The freezer is super cold. Workers wear as many layers as they can to stay warm, but it's difficult. In the past month, 2 of my coworkers died from COVID-19. The company did institute protective measures, but it was too late for them. The virus spread quickly through our communities. I work in a plant with 1,400 employees. A majority of us are immigrants. Company-wide communications are translated into Spanish, Arabic, and Haitian Creole. Our work is essential to feeding the nation. Yet plants like mine have become hotspots for the virus. And on Tuesday, she's now referring to back in April when former President Trump said that he would declare meat processing plants crucial infrastructure. So she refers to that to avoid a shortage in the supply chain. But already thousands of meatpacking workers across the country have become sick at work. Our union, the United Food and Commercial Workers Union, demanded at the national level that meatpacking plants restructure themselves to accommodate safety measures and provide personal protective equipment to all employees. Our plant did close before these deaths, and JBS remodeled the floor in line with coronavirus safety measures that were ordered by the Secretary of Health for Pennsylvania. Before this closure, people had started to panic. Social distancing was limited. Employees didn't cover their mouths. In meatpacking plants, workers are piled up on top of one another, often touching because there are so many of us. Many decided to stay at home on leave because they were afraid of becoming infected or of spreading the virus to their family. The 2 people we lost to the coronavirus were most likely exposed at work before the factory shut down. One was our principal union steward you see here, Enoch Benjamin, a 70-year-old Haitian man. He worked at the plant for 12 years and did so much to defend the rights of his colleagues. He was diabetic and suffered from asthma. He loved to work, and he worked until the last moment he could. They will not be forgotten. During this pandemic, we are living day to day. We don't know the new dangers that we will face in the future. We have to act quickly to protect our essential workers. So a lot has happened, of course, since the letter was written, and I'll talk about that. I want to share a little bit about the industry so we could put things into context. These industries are dominated by a handful of mega corporations, some of which span the globe. The industry has consolidated over the past several decades. And the companies you see listed on my slides are the companies responsible for the bulk of the meat, pork, and chicken that is processed in the United States. The average large meatpacking plant will have about 2,500 workers working there, some larger, some smaller. In pork, these are the major companies you can see listed here. The largest pork plant and actually largest meatpacking plant in the country is down in North Carolina. It's a Smithfield plant and employs approximately 5,000 workers. It's like a city in there. And then in the poultry industry, as you can see here, only about 30% of the industry is unionized. I know I'm going through the slides quickly. Previously, if you didn't see, we have high union density in pork and beef, low union density in poultry, which leaves about 70% of workers in the industry not represented by a union. So before the pandemic, meat and poultry plants were already dangerous places. Hazards include dangerous machinery, screw augers, large saws, hundreds of moving belts and other machinery, slippery floors, loud noise, work with sharp knives resulting in cuts, lacerations, and amputations. There's a very high rate of those in plants, and there are chemicals. PAA, which is an antimicrobial agent used ubiquitously in the poultry industry, anhydrous ammonia, thousands of pounds course through the refrigeration system in these plants. And then some of you may have heard about the liquid nitrogen leak at a poultry plant in Georgia recently that killed 6 workers and sent 11 more to the hospital, some of whom are still hospitalized. Liquid nitrogen is used in flash freezing product. And then finally, I'll just mention that the largest majority of injuries suffered by workers, both in poultry, but meat and beef and pork plants are musculoskeletal disorders. In poultry plants, there's twisting, forceful motion, sometimes completing more than 2,000 cuts per shift, hanging more than 1,000 birds or carcasses during a shift. The work is hard and repetitive. So, and I know this presentation is about COVID, but I'm sharing this with you because while COVID has been our main focus for the past year in meat and poultry plants for workers, companies, and the union, these other hazards still exist. And a worry for our union is that attention has been pulled away from all of these other very dangerous hazards that exist in plants. Traumatic injuries are still occurring. Deaths from other causes are still occurring. So many plants are running short are running short of being fully staffed. And by being fully staffed, I mean being crewed properly and in a safe manner so that workers can keep up with the speed of the lines and with production demands, which then reduces the risk of suffering an injury when they're fully crewed. There's always been a high turnover of workers in meatpacking plants, but now so many workers have been made sick. Many are out on leave that companies cannot fill all of the positions. And the situation is improving. Infections are decreasing, but there are still outbreaks that we are hearing about, and we don't really know what's going to happen going forward. By default, companies early in the pandemic did have to slow down lines, They just did not have enough workers to do the work. In a JBS plant in Hiram, Utah in early June, the peak absentee rate was over 40%, which caused a temporary shutdown of the plant. And I've asked our local unions recently, have line speeds slowed down? Is production reduced? And I have to be honest, a lot of companies are not slowing down the lines or reducing production. And so we're seeing a couple of things. Workers are being asked to work longer shifts. There is, in some cases, forced overtime. Some plants run 6 or even 7 days a week instead of 5 or 6 days a week. At our Smithville plant in Sioux Falls, South Dakota, I've been told there is a great deal of filling in gaps in the production line with workers from other departments. And this results in workers maybe not being fully familiar with the jobs they're doing, and which increases the risk for injury. And with respect to COVID, we know that the risk of contracting COVID increases with the length of exposure to the hazard. So with longer hours, shifts, number of days in the week of being in the plant, and the potential exposure to workers who may be pre-symptomatic, asymptomatic, you can see how there is a higher risk of contracting COVID with the conditions I just described. So I'm just going to share with you a few photos because I'm going to go on to talk about conditions that have been found, and environmental conditions that have been suggested to contribute to the spread of COVID in meatpacking. This is a pork plant. This is on the slaughter side, obviously. So plants are typically split between a hot, a slaughter side, and they are hot many times. These carcasses go through a chiller, and then they come out on the fabrication floor, which I'll show you. And you can think of these plants as basically disassembly plants. So in a car plant, you're starting with small items and building up to a big car. So in a meatpacking plant, you start with these big items, cows and pigs and chickens, and then you slowly reduce them down to their parts. You can see how close these workers are. Now, not all plants look like this. These are very old slides, by the way, from a large pork plant in Canada. So it may be that, some plants have automated. There may be plants that are more spaced out doing this particular job, but this is not uncommon. This is the part of the plant where workers work very close together, very typically work close together in processing internal organs, intestines, et cetera. But you can see it's hot and it's humid in this part of the plant. And after the carcasses come through the chiller and they're now cooled down, you get to the fabrication side. And again, you see the close quarters here. You can see the meat is all run on these conveyor belts. Some are worked on chains, but by the time it gets to here, the fabrication side, you have a lot of mostly hand work. You see knives. Workers face each other on the lines. This is the packaging, a part of the packaging department. And again, this is so common in these plants. The workers may not necessarily be close together here, but it's very congested. And typically companies when they increase production, they put more and more lines in. They're just, sort of squeeze the lines in without necessarily expanding the space. So you can just, again, see the congestion. And this is the last slide. And this just gives you the depth of a large fabrication plant. And the work is all tied to those conveyor belts that run in front of them, and they're timed as to how many cuts they make in a minute. So this is my favorite slide here. Okay, the famous barriers. I'm going to talk a minute about barriers. You can see here on a typical fabrication floor, and I think this is happening in almost every plant in the country, these plastic barriers. Some are plants put up stainless steel barriers. You can see by where these the stands are, I don't know if I have a, I don't know if you can see, but if my pointer shows you, but the stands are all exactly close together as they were before the barriers were put up. So those workers still may be only a foot or two apart. So they're not, workers are not spaced out any further, but simply the company simply just put up these dividers. So many observations were made by CDC when they went in, and it was referred to earlier by CDC. They went in to do a lot of investigations early in the pandemic into some of these large meatpacking plants. They went through poultry plants up and down the East Coast, and they made observations and they made recommendations. And I want to highlight one of the recommendations here. And I feel these recommendations have been problematic and continues to be problematic from a mitigation of the hazard standpoint. In the Smithfield report, CDC states that keeping, and I quote, keeping space between individuals, social distancing, is one of the best strategies to avoid being exposed to the virus and slowing its spread. And CDC goes on to make its recommendations, including the following, which you see on the screen. Barriers are one method to physically separate employees in areas of the plant. 2, considering the following actions to physically separate employees, at least 6 feet where possible in non-work areas, such as cafeterias, break rooms, locker rooms. And we agree that, and we have emphasized as a union, and the companies have also emphasized that some of these areas where workers congregate, you can have hundreds and hundreds of workers congregating, and they are certainly congested, and they are certainly sources of spread. As somebody said yesterday when I talked to a local union, you know, workers are in these cafeterias, they're taking off their masks, they're eating. So certainly areas of spread. And companies have done many cases what they've needed to do, which is increase sizes of spaces where workers congregate, adding extra rooms and tents where weather permits, staggering shifts, etc. So there has been some of this work done in these areas, but in terms of the barriers on the production floors, we just don't know what they do. They may have no effect. They may have some effect, or worse, they may be making things worse. One thing we do know that is for some workers, and they've told us, it makes their jobs more stressful from an ergonomic standpoint. It limits the space that they have to do the work. So this is a step that companies took early on and may be continuing to do in their effort to stem the spread of the virus. And a lot of it was because of the CDC recommendations. We have talked about barriers not being equivalent to social distancing. We've talked to CDC a lot about this, and you can see we made some progress. In this report, CDC states physical barriers should not be used as a replacement for social distancing and should be only used when distancing is not feasible. There have been very few, well, there actually haven't been any studies to my knowledge on actual barriers in a meatpacking plant. There have been some modeling in, I know, in universities on computers. But a study did just come out yesterday. I just saw it. I believe it's posted on a CDC site. They were looking at the researchers from University of Nebraska were looking at the effect of adoption of uniform masking and the role played by physical barriers. And they did see some effect with infections going down. But they go on to say that since the study period, which was, I think, early fall last year, evidence is mounted supporting the substantial role of aerosols in transmitting COVID. Although physical barriers installed between meat processing workers on the production line and at cafeteria tables would block larger respiratory droplets, which the CDC, they note, notes is the primary mode of transmission according to the CDC. I editorialized that to say the CDC still insists that's the primary mode of transmission, although they are starting to recognize the role of airborne transmission. These barriers would not fully protect against aerosol transmission. Moreover, low temperatures and limited fresh air supply combined with physically demanding work conditions could facilitate longer range aerosol transmission. And the researchers recommend enhancements to ventilation, including increasing the number of air exchanges per hour and installing high efficiency particulate air filtration as the most effective engineering controls for COVID. But more study is needed, and I'll talk about that in a little while. So I want to talk about what we do know about conditions in plants that contribute to the spread and outbreaks. We know workers work very closely together on lines that don't allow for spacing or distancing. We know these jobs, many of them, if not most of them, require a great deal of physical exertion. There is this, and it was referred to earlier, actually, in one of the talks, there's a work while sick culture in meatpacking and poultry. Unfortunately, there are many incentives and disincentives to be at work, even when sick. We learned of a responsibility bonus of $500 being offered to employees who did not miss time from work during the time period between April 1st, 2020 through May 1st, 2020, when there was quite a bit of spread, by the way, of COVID at that time in meatpacking. The company informed us at the time, when we found this out, that COVID-19 related absences did not affect the receipt of the bonuses. But I think you can imagine that this is not a good policy or program, and we don't agree with these types of incentives, bonuses, which may incentivize workers to not report symptoms of COVID and come to work sick. We know in poultry, in non-union poultry plants, workers are assessed points for many offenses related to being late, calling out, not coming in to work because of being sick. So it does not take very many points for a worker to lose his or her job. So one of the few studies that looked at the spread of the virus inside of a meatpacking plant was conducted at a German meatpacking plant following a super spreading event. It actually, you might have read about this, and the investigators looked at conditions to understand how that large, very, very large outbreak occurred inside of the meat processing plant. So the investigators found that transmissions occurred in a confined area of the meat processing plant in which air is constantly recirculated and cooled down to a temperature of 10 degrees centigrade. An index case transmitted the virus to workers in a radius of more than 8 meters during work shifts on 3 consecutive days, and 8 meters is about 26 feet. The investigators stated in their conclusions that their results indicated climate conditions and airflow as factors that can promote efficient spread of SARS-CoV-2 via distances of more than 8 meters, and provided insights into possible requirements for pandemic mitigation strategies in these type of industrial work settings. This is a graphic that was in that particular study and report. On the top, in the number 1 is the area where the super spreading event occurred. That's the fabrication side. In B, you can see workers standing at the tables there. And in this plant, and this is typical in plants, and I should have showed you in one of the slides of the photos, but I'm going quickly. There are cooling fans above there, and those cooling fans blow directly down onto the workers. And then the bottom shows the perforated cooling fan and the airflow. So, you know, meatpacking plants are very complicated environments. There's constant air movement. There are the ammonia refrigeration systems that are moving throughout the plants. and coolers and chillers. So there is a lot of, there's a lot going on. So they are very complex environments. And I'll just state finally, going back to the German study, they state that aerosols are believed to be particularly important in cases where a single source transmits the virus to a large number of individuals, these so-called super spreading events. And the speaker before me talked about that. Whereas droplets typically travel no further than 2 meters, aerosols can stay in the air for prolonged periods of time and may deliver infectious viral particles substantially beyond these 2-meter distances, especially in indoor settings with low fresh air exchange rates. So meatpacking plants and poultry plants have very low to almost none fresh air exchange going on. And then factors such as temperature, humidity, and air circulation are thought to significantly influence stability and transport of droplets and aerosols, and consequently transmission efficiencies. And as we saw, and as I stated, meatpacking plants on the fabrication side operate at very low temperatures, and there is a high density of workers. More workers are on the fabrication side than on the slaughter side. While no one to my knowledge has actually documented where most of the cases are coming from inside of the plants, in my discussions with CDC and the unions and our own members, we believe that a large percentage of cases of COVID are on the fabrication or cold side of the plant. And finally, we are working with University of Nebraska Medical Center, which has access, obviously, to a lot of meatpacking plants. So the UFCW is partnering with this research institution, along with one of our large companies who is allowing the study to take place in several large meatpacking plants. This took a long time to get off the ground. I personally was ready in May. We just started in the fall planning it, and finally next week they're going into their first plant. The risk factors for contracting COVID, and this is in their research proposal, the risk factors they note include significant number of workers per shift, proximity of workers on processing lines, prolonged duration of contact among workers, and the enclosed nature of these facilities. And the goal of the project is to characterize SARS-CoV-2 aerosol transmission in meatpacking facilities. And their steps they're going to take include assessing function and behavior of HVAC systems and airflow, taking air samples, doing surface sampling, and then sampling analysis to detect SARS-CoV-2 contamination. With the goal, the aim of providing guidance to inform appropriate administrative and engineering controls to reduce aerosol transmission of SARS-CoV-2 in meat processing plants through objective measurements that are validated through worker testimony and interviews. I mean, I will, one thing I glossed over, I did want to say that in its proposal, and I can't put it any better than these experts from the university. They state that some of the CD recommendations, like plastic barriers between workers, have been implemented without evidence to be effective in reducing transmission of SARS-CoV-2 in meatpacking facility context. And other recommendations that CDC did put out there were designed to control droplet transmission of the virus. But there is little known about the potential for aerosol transmission in these facilities, particularly given the diverse climates between slaughter and processing and packaging divisions. I will close with priorities. These are only some of the priorities, and I want to state that our priorities are for both workers in UFCW represented facilities and all workers inside of every meatpacking and poultry plant in this country. So we would like to see more studies on the spread of infectious virus inside of a poultry or meatpacking plant. We'd like to see more attention to engineering controls to control exposure to SARS-CoV-2 virus. including looking at ventilation and working with HVAC experts and technicians, and ideally those who have actually familiarity with meatpacking and poultry plants. Redesigning workstations, spreading workers further apart to reduce exposure, which may include both line speed reduction or, where possible, extending production lines. We think that to control and prevent outbreaks, there has to be aggressive testing protocols, offer testing on site if possible, at no cost to workers on work time, contact tracing, and then create policies and programs which allow workers to be away from work who have fit into all those categories. And then paid leave should be standard practice for workers who need to be away from work due to COVID-related issues. I am done. I don't even know how long I took, but thank you for your time.
Thank you, Robyn. We have a couple of questions. In addition to hazard controls, vaccination has the potential to decrease transmission among workers. What's your understanding of the current level of vaccine access and vaccine confidence in this group of workers?
So that's a great question. Vaccines are being rolled out. Sorry, I turned my phone off. Vaccines are being rolled out where our companies and unions can work with the state. So in the state of Illinois, JBS was actually able to work with the state of Illinois, the local Department of Health, and gain access vaccines. And they had a fairly decent rollout of the vaccine at this JBS plant in Illinois. But it was only 700 workers so far out of a plant of about 2,000. And this I just learned yesterday. So I don't know about the extent of uptake by workers. There's obviously a lot of distrust. There's a lot of fear among the workforce. I know that we're working in our local unions to work with companies to develop materials that are culturally appropriate, in language that are in the languages our members speak and workers speak. So we're trying to do a lot of education. We're doing a town hall next week, but I can't, I don't know right now how easy this is going to be.
And one other question, are safety people included in the meatpacking production planning? And have the tent setups you mentioned only been used for breaks, or are they used for actually workspaces?
No, second question, no, not for workspaces. It's really mostly been, as far as I can tell, for breaks and where workers can eat their meals. It would be pretty hard to put workspaces out there. But I will say that, again, in talking to some of our local unions, I try to check in as much as possible. Companies are actually relaxing that. They're actually going back to putting large numbers of people in the indoor cafeterias and workspaces. Obviously, some of the places where plants are located are cold, so they can't viably do tents outside. But even before that, in the fall, I heard this. We have very active safety committees in many of our plants. I mean, one of the good outcomes of, if there can be any good outcomes of the pandemic, there really aren't, but our safety committees have been very active in many of our workplaces, working with the companies in trying to implement controls and assessing risk, et cetera. But that's not everywhere.
Thank you so much, Robyn.